Good day, everyone. I'm Jane Carter, Professor of Medicine at Brown University and former President of the Union. Apologies for my feedback for a moment. I'm very happy to welcome you all today to this special session in plenary entitled TB UN HLM, Are We on Track? We have 4 speakers with us this morning, and then we'll be followed by about 25 minutes for Q&A. Our speakers will be Dr. Teresa Kaseva, Director, WHO Global TB Program, the Honorable Angelina Helen Tan, Chairperson, Committee of Health, House of Representatives, the Philippines, member of the Global TB Caucus Executive Committee, and co-chair of the Asia Pacific TB Caucus. Professor Tushar Nair, the Regional Manager for the Asian Pacific region of the Global TB Caucus, and Ms. Blesina Kumar, CEO of the Global Coalition of TB Activists. Please go ahead and feel free during the talks to begin to fill in your questions in the question and answer section of section of the platform. I'm going to hand this over now to start our video. Thank you.
Hello, everybody. My name is Dr. Teresa Kaseva. I am Director of the WHO Global Tuberculosis Program. And I'm happy to be today with you and to talk to you about a very important subject about our progress since first ever high-level meeting on TB. And I would like to declare that I have no conflict of interests. And so with this, let's start. I would like to start with very important data. TB is the top infectious killer in the world. According to WHO Global TB report, to the latest report, 1.4 million people died from TB in 2019, including more than 200,000 people with HIV. It's really striking. We all were inspired by our first ever high-level meeting, UN General Assembly high-level meeting on TB, with a high-level focus, commitments, and targets. It gave us really historic chance to move forward. And I would like to remind the key targets and commitments from the political declaration of the UN high-level meeting. 40 million people should be successfully treated from 2018 to 2022, including 3.5 million children and 1.5 million people with drug-resistant tuberculosis. 30 million people for the same period should receive preventive treatment with specific targets for children, household contacts, and people living with HIV. Sufficient and sustainable financing is becoming really critical for our fight against TB. All the TB community, TB activities and programs are severely underfunded, and we need at least 13 billion a year by 2022, with an additional at least 2 billion a year for TB research and innovation. We all know that multi-drug resistant TB is a real global public health crisis. More than 5,000 people are suffering and falling ill with this severe form of TB every year. Policies and systems should be strengthened and focused on provision, sustainable access to TB diagnosis and treatment for all. Multi-sectoral collaboration and actions are becoming critical, especially now we can see during the new pandemic and coming threats. TB is dependent on the socio-economic factors heavily, and it's driven by the determinants such as poverty, malnutrition, alcohol use, tobacco smoking, and others. That's why this issue should be addressed, and meaningful engagement of all partners and all sectors of economics should be provided. And of course, with the special role of the civil society in these processes. So when we're talking about determinants, we should not forget about the key driver of the TB epidemic. It's still stigma and discrimination. And we should strengthen our response to these issues. We should pay special attention to the poor, vulnerable, and communities at risk. Research and innovation is another important area of our joint efforts. And investments in research are absolutely essential. Without new approaches for the diagnostics, without point-of-care tests, without shorter and safer treatment, it's impossible to provide the better quality treatment for all the millions suffering annually. Two more highlights. These are special requests to the WHO, and one of them was continuation of the development of multi-sector accountability framework and ensuring its timely implementation. I will come back to it later. And the last point was about a review of the progress, which should be done on regular basis. And the first milestone and the first review was developed in 2020 by request. I will again come back to it later in my presentation. These are main commitments and requests addressed to WHO. And following this principle of the responsibility and accountability, WHO Global TB Program would like to start from ourselves. And I would like to inform you what has been done since a high-level meeting on TB. As requested, we've finalized and presented multi-sectoral accountability framework. And in addition to it, we developed checklists to support countries in its adaptation and implementation. Here you can see the examples of the activities undertaken immediately after the meeting, and just few of them. High-level missions to the highest TB burden countries with advocacy, with the technical support, and more than 60 countries were provided by technical support. 20 national program reviews were undertaken, and 20 patient cost survey. These are just the main activities. In terms of WHO core function, we've managed to update and all our core guidelines on the diagnosis, treatment, infection control, on the preventive treatment, and we also developed very instrumental tool, people-centered framework for the program planning and prioritization. Two roadmaps are absolutely critical, roadmaps towards ending TB in children and adolescents, and a roadmap on the meaningful engagement of public and private care providers. And all these documents were in place before the pandemic. You know that all our life now divided into two parts, before pandemic and now during, and hopefully soon we will overcome it. Global TB report, which is coming, it's another well-known tool, document, and which could be used for very practical purposes and also for the strong advocacy. And here you can see we have app version of the report and country profiles with the details, including social determinants. NTB dashboard is another essential tool which is used for the online monitoring of the situation, even at subnational level, and it helps to take timely actions according to the changes in the situation, according to some concerning gaps, significant gaps in the provision of care, which could be seen immediately. Civil society, as I told, and its meaningful engagement is absolutely essential for the success of any activities towards ending TB. And we are very proud of our colleagues from the WHO Civil Society Task Force who are working with us back to back, very close, and providing meaningful contribution in all our core activities. Another example of engagement, communities non-engaged before, is youth engagement. We've launched new initiative 1+1, and Director General Dr. Tedros is also engaged in these efforts, and we can see how they're inspiring youth, how they're inspiring the world and engaging them in the fight against TB. Global research and innovation strategy was developed, and I'm happy to say that it was recently adopted by the World Health Assembly. It should become a very important strategic document to navigate, to guide member states, stakeholders, manufacturers on the priority activities and how to make all our advantages and achievements, new tools available and applicable for the needs of the patients, for the better diagnostics, for the better treatment. And I think that you will all use and follow these core principles. As I told, it was requested that Secretary General will present report this year, developed with the support of WHO Director General. We've followed this commitment, and you could see that the comprehensive review of the progress towards global targets, progress in translating commitment into actions, including essential recommendations, as well as overview of the impact of the COVID-19 pandemic and its implication on the progress in TB. All these elements are included in the report, and this overview was done during the official side event at the latest UN General Assembly. Now, a little bit in more details, I would like to focus your attention on the progress itself. These are well-known anti-TB strategy targets. And if to be clear, the milestone targets for 2020. Remind you, we were aimed to reduce TB incidence for 5 years by 20%, TB deaths by 35%, and no patients and their families should suffer catastrophic cost due to falling ill with TB or due to treatment. And here you can see the progress. We've made the progress, but unfortunately it's not sufficient. 9% of reduction in TB incidence versus 20%, 14% in reduction of TB death. But there are also some good news and examples. We can see that at least one region, European region, succeeded to meet these milestones, and few high TB burden countries are also either met or on track and will be able in 2020 to meet these targets. It clearly shows that it's possible, and despite of all the circumstances, we should strengthen our response and efforts. Now I would like to show the progress towards reaching UN high-level meeting targets. 40 million target for the treatment of people with TB, what can we say? We are moving forward. 14.1 million people were treated for the 2 years. Of course, it's significant progress, but we should again increase our efforts, and we should continue moving forward. 30 million target. We've managed to reach 6.3 million people and provide them preventive treatment. Financial targets were unfortunately also not met so far. We've managed altogether to receive 6.5 billion out of 13 billion we need annually. In terms of research, it's less than 1 billion. And again, dear colleagues, we can see that especially looking at the current situation with fundraising for COVID, that it is possible. And it means that we should strengthen our advocacy and do more for fundraising. And now about COVID-19 pandemic, of course, we can't ignore, and we are not ignoring. And I would like to thank all the community health workers, all the health workers, and all the partners who are now at the first front of the fight with the TB as well as with the COVID. We know that TB programs and TB specialists are contributing heavily in the fight against COVID-19. But unfortunately, we can see that pandemic threatens to reverse recent progress towards global TB targets. Based on WHO modeling and analysis of impact of COVID-19 on TB deaths, it's indicated that a drop up to 50% in TB case detection over 3 months will lead to an increase in the number of TB deaths worldwide, and by nearly 400,000 in 2020 alone. It's a very, very serious concern, and it's reasonable concern. And we should try to do our best to avoid this further growth in TB incidence, and especially in TB death. Now, here you can see that immediately from the very first day when pandemic were announced and the WHO were heavily engaged in this COVID response. In the same time, we've never lost our focus on TB, and with the support of partners of engagement, we've developed guidance how to provide essential TB services in these current circumstances, giving preference to the home-based treatment, to the more active use of the digital technologies, to the provision of the drug supplies at home, and also infection control measures should be in place. TB preventive treatment also, and its role is becoming even more important. We should avoid a situation when people with COVID will be in the same time falling ill with TB2 severe diseases, primarily affecting lungs, will be too much and very difficult. We can expect much more poor treatment outcomes for these categories of patients. So we are continuing monitoring and analyzing situation, and we would like to thank all the partners and civil society working closely with us. And I would like to end my presentation with the top 10 recommendations of the UN Secretary General 2020 Progress Report. I think that we should use them all together and actively advocate for the country officials who are responsible for decision making, for all the stakeholders, funders. First of all, we should remind that we can't tolerate anymore, and we should avoid further growth of TB deaths. With use of modern approaches, with the multi-sectoral actions, and it's absolutely essential. For this, we need urgent increase of funding for essential TB services, including for the health workforce. And universal health coverage should mean for us access for all TB patients for the TB diagnosis, treatment, and preventive treatment. So this is our main principle, and it should be in place. Drug-resistant TB crisis should be addressed, and as I told, we should dramatically scale up provision of TB preventive treatment. Stigma and discrimination should be significantly reduced. We should combat and avoid, we can't tolerate it anymore. Meaningful engagement is absolutely essential in all our steps. Investments in TB research and innovation should not be neglected, especially now. We need urgently new technologies, new point of care tests, and new treatments. Prevention and care should be safeguarded in the context of COVID-19 and other emergency threats. And from our side, from the side of WHO, I would like to reaffirm reaffirm our commitments that we will continue provide global leadership for the TB response, working in close collaboration with the member states, all the stakeholders, partners, and including for the preparation for a high-level meeting on TB in 2023. It's time for action. We will not have another time, and we should overthink about our patients, people's suffering with TB all over the world. Thank you.
Good day. I wish to thank Executive Director Jose Luis Castro and Dr. Karen Medokop for the kind invitation. I was asked to talk about the successes and challenges driving country-level political commitment under the theme for this year's conference, Advancing Prevention. Amid the ongoing COVID-19 scare that is already hurting the global economy, snuffing the lives out of so many the world over, and putting everyone at risk, I am happy to note that we are not losing sight of the fact that tuberculosis remains to be the world's leading infectious killer and is found anywhere. While many are aware of the persistent cases of COVID-19 in many parts of the globe, very few of them realize the staggering fact that since 2000, over 30 million people have died from tuberculosis across continents and countries of the world. I do appreciate Dr. Caseva's presentation that give us the hits and misses of our global targets in the UN high-level meeting's political declaration on tuberculosis. Of course, there are successes, the bright spots, and our targets, and we thank the collective efforts of everyone in bringing into fruition whatever progress we have made at the halfway mark of the deadline in 2022. What is constant, however, are the challenges that we face, especially on the heels of this or of the perilous spread of the COVID-19 pandemic that is yet to see its own end. The advent of COVID-19 has proved to be an enormous hurdle to TB elimination efforts. That cannot be denied. Because of the pandemic, the governments are challenged to ensure the continuity of essential health services such as cancer control program, immunization, and of course, TB services. Before us is a weekly TB case notifications in the Philippines based on the interim time series analysis using integrated taxonomic information system data. We note two things here. One is the non-significant decline in the TB notification over the period before community quarantine, which was from January to the second week of March. Thereafter, immediate decline of 78.7% of TB notifications in aggregate TB counts can be seen following community quarantine, which became effective on March 16. This was followed by a non-significant increase in TB case notifications over the period after community quarantine. Overall, there was 51.8% decline in weekly TB case counts by end of the 10-week post-quarantine period. In the daily case TB notifications, we can see a 20.2% immediate decline in daily TB case counts reported, and this was associated with the community quarantine. And then 55.7% decline in daily TB case counts was seen by the end of the 7-day post-quarantine observation period. We all know that TB is very much unlike other health programs where having fewer cases serve as an indicator of success. That is not the case for tuberculosis. We know by scientific data that it is prevalent, so it is just a matter of finding who have the Mycobacterium tuberculosis and treat those who have the infection. Unless we find and treat those who have TB, this ancient disease will persist long after we have controlled or even eliminated COVID-19. The issue here is that community quarantine has disrupted various health programs such as TB elimination efforts. Many are saying this is a terrifying scenario as these patients, those who are TB infected, may largely continue to spread the infection. It may also lead to treatment failure and emergence of drug-resistant TB, which should be a cause of concern. We need to maintain a high-quality, uninterrupted TB care even as we respond to the current pandemic. That's the initial challenge. But that is easier said than done as financial resources of various economies of the world over are slowly being depleted by the massive demands for funds in controlling the spread of coronavirus. The next challenge is how to finance health. Universal health coverage if you have it. Then the duo of COVID-19 and tuberculosis. Many health systems, even before the current health crisis, are already overstressed and underfunded. I cannot imagine how they are today. I believe resilience and sustainability must define what a post-COVID-19 health financing must look like. And so it is with TB financing. Significant investments in TB surveillance would be a critical factor in our fight to end tuberculosis, which must include large-scale testing and detection. One of the important amendments that I have introduced in the landmark Philippine TB law is the inclusion of a framework for private sector participation, primarily to augment the government funding for tuberculosis, which has sadly fallen from the current 950 million pesos to 500 million pesos as proposed in the National Expenditure Program of 2021. This is really bad. We need the private sector to be on board. So I am pushing for the legal provision under the TB law amendment that will encourage private sector participation in the National TB Elimination Program, which will include the private corporations, civil society organizations, non-government organizations, and other foreign and local groups or organizations. All business organizations may contribute in the government's continuing efforts to reduce the incidence of TB in the country by conducting TB prevention or other projects that encourage healthy lifestyles and early detection of TB as part of their corporate social responsibility programs. The Health Department, in return, is mandated to give national recognition and rewards to all business organizations for outstanding, innovative, and world-class CSR-related services for TB elimination. Again, in terms of financing, I have sought the convergence of services of other government agencies, such as those in the labor sector, social services, local governments, and education, for them to share in the burden of financing the indirect costs of accessing TB treatment, transportation, meals and accommodation or halfway house, including training programs for their livelihood. I am also working for inclusion of alternative financing schemes, tax exemptions, other sources of funds, and mandatory appropriations to ensure sufficient and sustainable support to end the TB epidemic. These are financing challenges which should not be a problem if they are only matched with an unwavering political commitment on the part of the government leadership. Sustaining political will to end TB, sustaining the momentum gained from the historic UN high-level meeting on TB is intensely critical if we are to be on the target. Final challenge given the global health context that we are into right now is not only to continuously destigmatize TB, but to destigmatize the infectious diseases as well. We all know the TB symptoms and that of COVID-19 are quite similar, and as much as both infectious diseases that attack primarily the lungs. A TB patient already stigmatized for having symptoms such as fever, cough, and difficulty of breathing will not only create diagnostic confusion, but can experience further stigma as they may also be viewed as having COVID-19 infection. This double stigmatization may prove to be a tall barrier that could hinder more people from seeking immediate medical attention the moment they exhibit such symptoms. We need to do something about this. The road to 2022 global TB targets is certainly paved with roadblocks that is now even more difficult because of the pandemic, which is why TB elimination efforts need a breakthrough. We don't necessarily have to decrease our goal. We don't need to lower our expectations. But we definitely have to increase our effort. Walk the extra mile, burn the midnight oil, persevere even more, and continue the fight. We still have time. We still have the chance. And let's make it happen. Thank you very much.
Good morning, good afternoon, good evening, ladies and gentlemen, from wherever you're joining. Firstly, I'd just like to disclose that I do not have any conflicts. So the question that I've been asked to address is, how do we assess and demand accountability? Firstly, I'd just like to take a moment to acknowledge all the thousands of people who have died this year from TB as well as from COVID, and thoughts going out to their families and the countries who've experienced a horrible loss this year. My name is Tushar Nair. I am the regional manager for the Asia Pacific at the Global TB Caucus. I also co-chair the Global TB Accountability Platform with my colleague Aaron Oxley from Results UK. So I thought I'd start off the presentation with a quote from one of the executive members of the European Central Bank. And I think it really encapsulates a lot of the things that we want to talk about in terms of accountability, the different players and all the different dynamics that exist. So it goes that the demand for accountability has been increasing across advanced economies and across institutions. It's a trend that reflects questions stemming from the crisis as well as from societal and technological changes. So people want more answers more quickly. But we also need to be mindful that direct, instant, and constant communication does not necessarily translate into stronger accountability. And in our constitutional democracies, parliaments and courts are provided as fundamental checks and balances, and that is for good reason. So I thought this quote really helps encapsulate all the different players and the dynamic that we are trying to unpick with the whole issue of accountability. So what is accountability? In terms of governance, when we think of accountability, we're talking about answerability, blameworthiness, liability, and the expectation of reporting back. Specifically going back to the point of reporting back, which is quite important. And when it's properly structured and implemented, accountability ensures that independence does not lead to arbitrariness, and also that the mandate is fulfilled, which is obviously central. Accountability can also not exist without a reliable mechanism and clearly defined metrics. So in the absence of accounting, we have an absence of accountability. In other words, we cannot manage what we don't measure. And to be honest with ourselves, we are not at the moment measuring accountability effectively. So what does accountability look like for TB? As per the WHO multi-sectoral accountability framework, we as the TB community have defined accountability to look like this in this image. So we have a set of commitments that are then backed up by actions which are monitored and reported upon, which are then reviewed and ideally would feed back into the commitments themselves. So it's the cyclical process that we've developed, and this is how we define accountability for TB. What do we have in terms of commitments? Well, at the global level, we obviously have the Sustainable Development Goals. We have the high-level meeting targets as well and the NTB targets. At the regional level, we have targets that are set by regional platforms such as the African Union or the ASEAN or the PALASEN and so on. At the national level, these targets are laid out in the country's national strategic plans, and obviously these are then broken down further at the subnational level. What we really need is to make sure that there's strong coordination and communication between each of these levels, and that the targets being set at each of these levels are mutually reinforcing one another. So what we really need at the end of the day is a strong, inclusive, representative, and connected review mechanism for fora at each level. This is just a short sort of framework that I've put together for us to take a look at all the different components of the accountability mechanism that we've been talking about, and breaking them down from the global all the way down to the subnational level. So we have actions, we have the monitoring, reporting, and the review. I won't go into detail for each of these, but I'm hoping that a structure like this will also help us assess where we have mechanisms that are sufficient and where we really need to strengthen them. Also, just noting that there needs to be communication, not just vertically between each of these structures, but also horizontally, so across the different levels as well as across the different pillars. So how do we assess government's responses? Well, I think the simple answer to this question is that we do that by using the multi-sectoral accountability framework and by pushing for its implementation, by pushing for the implementation of its checklist and its report back. Just to mention here that the Global TB Caucus has also prepared a checklist specifically for parliamentarians that fits in with the broader global multi-sectoral accountability framework. So I want to give a few examples of what I consider, and I think what we broadly consider to be robust accountability measures that are taking place at not just the national, but also the regional and global levels, with just a few illustrations. So, for example, in Indonesia, we had the presidential high-level meeting where there was a lot of interministerial coordination, and the TB budget has almost been tripled. In Nigeria, the HLM targets have been broken down to the national level, and then now work is being done to implement them subnationally as well. In fact, Zambia has already surpassed the UN high-level meeting targets for preventative therapy and MDR treatment success rate. In Tajikistan, we saw a 7% increase in budget for health and also the adoption of a resolution on TB and COVID. The Philippines has recently updated their existing TB law and also introduced a new law on health security. In Pakistan, in the midst of this pandemic, parliamentarians got together and they have established a national TB caucus and are currently in the process of establishing provincial caucuses as well to make sure that there's strong coordination between elected representatives at the national and the federal, at the federal and at the state, at the provincial levels as well. We saw that in Australia this year, our co-chair Warren Ench from Australia, along with the Minister of Foreign Affairs and the Minister of Health, announced a $13 million pledge for research and development for AMR and drug resistance. Last year, we saw donor countries coming together and parliamentarians working very, very strongly and closely with civil society to make sure that the Global Fund was fully replenished. And soon we will be launching the Lusophone TB caucus for the Portuguese-speaking countries. Over the course of the lockdown, our parliamentarians have also been busy. Very recently, MPs from the Americas TB Caucus got together to talk about accountability in the region with specific discussion on what needs to be done now given COVID. It had members of parliament from 12 countries and civil society representation from 9 countries across the region, as well as representatives from the WHO, PAHO, the Global Fund, Stop TB Partnership, and the National TB Program of Brazil. The meeting concluded with a series of recommendations on what parliamentarians need to do. One of the strong ones being the need for coordination with national TB program managers across the region. In the Francophone TB Caucus, they've recently signed a partnership or have made the partnership official with Draft TB, which is a civil society network. And the purpose of this partnership will be to make sure that members of parliament are receiving sustainable and continuous support from civil society, particularly on the meeting of the HLM targets. So this support will be going to 12 countries in the region. Very recently, just on the 11th of October, we were invited to be part of the ASEAN TB conference. And at that conference, we were asked to talk about the role that parliamentarians can play in helping ASEAN countries meet the high-level meeting targets, as well as the development of a regional referral mechanism. So I want to talk a little bit about the barriers to accountability now. And since we're talking about this at a more global or an abstract level, so to speak, one of the very key barriers to accountability is that countries often see oversight as a threat to sovereignty. And this is quite interesting to note because if you think about it, countries are more than willing to sacrifice sovereignty for oversight when it comes to issues of economy or energy or trade. But that is not the case for health. So this is an issue that we really need to all be thinking about as a group and a community, and making sure that lessons being learned and experiences are shared, and that transparency is leading to accountability. So how do we address this issue? Like I said, first, we need to make sure that we're aligning accountability with sovereignty. Sovereignty is not threatened by accountability, whereas it is in fact strengthened, and we're avoiding this accountability deficit as it may arise. We need to be generating much, much more evidence on accountability as an issue. Governments need to be sensitized, and they need to be taking ownership of the HLM targets. The meeting of these targets cannot come from one side. It's a social contract between members of parliament, civil society, voters, governments, partners, and their neighboring countries and donors. We need to change the narrative. We need to change the narrative to be that TB is a cheap and effective investment in our future. For too long, health has been considered a luxury investment, and I hope that over the course of this year, we've all really changed our minds about that, and we realize the fundamental nature of investing in health. Finally, the onus cannot lie with high burden or implementing countries alone. Donors also need to step up, particularly in light of the pandemic. We are going to need sustainable and adequate financing for the work that lies ahead. And lastly, this is a point I really want to make, is that we need a dedicated high-level meeting for TB in 2023. So I started out by trying to answer the question, how do we assess and how do we demand accountability? I don't know if I have given an answer, but I hope it's given us a lot to think about in terms of where we are, because we have a lot of questions to answer still. And I think I'd like to just conclude by saying that once we know where accountability stands, then we know how to improve and where we should be targeting these improvements. Thank you.
Hello, my name is Blessina Kumar. I'm with the Global Coalition of TB Activists. Today, I'm going to talk a little bit about the UN high-level meeting on tuberculosis, the commitments, and also why it is important for communities, what have the challenges been, and what is the way forward. And I'd like to also declare that I have no conflict of interest to report. So moving on, we all know that it was in 2018 that we had a landmark high-level meeting on TB, and we were very excited and to see the ambitious targets that were set by heads of state. They committed to doing all that they can to end TB by 2025, and the targets were set for 2022, and the numbers were huge. But because of the commitment, we all hoped and continue to hope that we can end TB as per our targets. Today, earlier on, a few hours ago, in fact, the Global Tuberculosis Report 2020 was launched. And if you can see the screen, it talks about the progress. While we have made a little bit of progress, unfortunately, it's also very sobering that we haven't really reached as far as we hope to be. If you see the little circles and the colors, except for one, which is universal access to TB, preventive therapy, diagnosis, and treatment and care, all put together, we're reaching about 50, but for everything else, we're really way, way below. And if you take TB preventive therapy on its own, we are really very, very low on our progress. So this is something that we need to keep in mind as we move forward and make, gear up for addressing TB in a more urgent and a different way than we have been doing till now. Now, we also have the UN Secretary General's 2020 Progress Report, which also gives an idea of the actions that are needed to accelerate progress. And what is really encouraging in this is that Not only does it talk about the treatment and the diagnostics that we all have been hearing for decades, but here it also talks about promoting human rights and combating stigma and discrimination. And this is for the very first time it has been taken up at this highest level. And we are really hopeful that we can make ending TB, the dream, a reality very soon. Now, why is it so important that I keep talking about it? It's important because communities, like us who are working on the ground, see death and suffering from TB on a day-to-day basis. And the frustration that goes with it, that it is a treatable, it's a preventable disease, and yet in a way, we are unable to do that and see our brothers and sisters die across the globe on a daily basis. So these high-level commitments, targets, give us hope that perhaps, this suffering and death doesn't need to happen. We can bring an end to that as well. So having talked about the targets, having talked about the commitments, the high-level UNSG report, it all boils down to accountability. These are all great in paper. They're all great in a report. But who holds who accountable? Who is actually responsible for ensuring that these actually work on the ground? And we believe that communities are actually best placed to hold governments and other partners to account. Because we are there right in the middle of things, we see the realities, and we are able to report back about what is working and what isn't working. Having said that, some of the mechanisms that have been put in place that we need to really take hold of and ensure that they work really like clockwork is the multisectoral accountability framework. There is a accountability platform, the Global TB Caucus that works with the parliamentarians, the community monitoring tools that have been developed recently, shadow reports that come up, civil society mechanisms such as the Civil Society Task Force of the WHO, representatives on global boards, the global affected community organizations such as the Global Coalition of TB Activists, and community treatment observatories. These are all very, very important mechanisms for us to ensure accountability, ensure that there is action on the ground, moving towards the targets, seeing progress that is far more than what we have seen so far. So, why am I talking about communities? Communities can actually bring that unique perspective that nobody else can bring, and can bring real data from the last mile recipients, because communities are there everywhere. National TB programs, ministries of health, even technical agencies like WHO, like Stop TB Partnership have repeatedly said, we are dependent on you, the communities, to give us the information. Just to give an example, this is a survey that was conducted by civil society partners on the impact of COVID-19 on the TB epidemic. It's a community perspective, and we had the global launch on the 15th of September. Now, the data here is extremely done well, and I've just got an India fact sheet from this report to just show you what are the different stakeholders, like people currently on treatment for TB, healthcare workers, policy and program officers, TB researchers, civil society, and communities have responded. And we have unpackaging of the responses and made it into numbers and figures and data that can be translated very quickly into ensuring action. Something like that, this is something we can actually present to ministries of health, to national TB programs for action. So this is one of the things that communities can powerfully do. Second is communities can bring evidence-based data. This is an example of conversations that the Global Coalitions of TB Activists have had with over 400 people affected by TB across the globe. And time and again, we heard how much TB stigma was impacting the cascade of care, how TB stigma was a huge barrier to complete treatment, to accessing care, to accessing diagnostics. So we went ahead and had conversations, and we came up with these 3 booklets that talk about women and stigma, childhood TB and stigma, men and stigma, extremely powerful stories being told by people affected themselves. Now, this can form a very strong data for action. Then there are fact sheets from our experiences. For example, the Global Coalition of TB Activists worked with USAID and other partners on stigma, again, to come up with a fact sheet actually saying what impact the stigma is having in an individual's life, and again bringing stories of individuals who are experiencing that. Now, communities are also best placed to provide valuable guidance that is based on ground realities, both lived, because communities who are affected have that lived experience, and through our experience of service delivery. Just to give you an example, recently we launched globally the Activating a Human Rights-Based Tuberculosis Response. This was done by the community, and it was presented to WHO, to Global Fund, to USAID, to Stop TB Partnership. And it has moved the technical agencies to, include this into the report of the UNSG for 2020. We are looking at how can we have indicators at the country level to show that there are steps being taken towards a rights-based response. So these are extremely important. Then the next one is something we did on TB preventive therapy. Very simple guidelines, working with Southeast Asia Regional Office of WHO, but to make it something community-friendly, easily understood, not the usual technical guidance that nobody can understand, but actually make it available for people to understand, where it answers a lot of questions that come up on why should I take it, who should take it, I'm pregnant, can I take it, I live with HIV, can I take it? So all these small questions that you may not find the answers to so easily in other documents are in this. So communities are really best placed to provide valuable guidance. So what are our challenges? And then what is needed for us to work together? I look at it like building a well-oiled machine. All the parts are important, irrespective of where they are placed, need to be oiled and need to be functioning for the machine to move forward. In TB, what we see is that there is a lot of attention and care to the top level, where there's drug development, where there's diagnostics, there's a lot of investment going into that. But when it comes to what is considered the smaller parts, which may not seem significant, but to move the machine, they are also important. And they need the regular oiling for the machine to move. And for this to happen, we need to listen to people. We need to value the input of the people. It's like market research. When a new product comes into the market, the developers, any product, they do market research to see what do the people think about it. That's why the advertisements on TV, television, irrespective of what the product is, they want to see how the people accept it and then change the strategy according to that. And we need to do that in TB as well. We also need to look at barriers very, very seriously. Barriers to delivery, barriers to access. And once we recognize those barriers, we need to develop strategies to remove those barriers. There's no point in identifying stigma as a huge barrier or human rights violations as a huge barrier if we are not interested to do something about it, something about removing those barriers. Now, for that, we need investment, we need funding. And also, we need indicators to ensure that these are happening and to measure whether actions are being taken to remove these barriers that are actually preventing people from getting better. How will those millions that we have set in our targets get better, get treated, complete treatment, if we do not invest in removing those barriers? So these are really, really important things that we need to look at, work with the communities, and move forward in a collaborative manner so that all the parts work together and ensure that the machine moves forward so that we can end TB together. Thank you.
Thank you to all of our speakers. We'll now begin to move into our Q&A time period, which is live. I have to let you know that the Honorable Helen Tan was not able to join us for this portion of the conference. I'd like to begin with a question that was posted by Arne van Deft. And I saw that in the chat, there's actually been a little bit of discussion about this. But I think this is just so important to bring the issue of TPT in, as highlighted by Dr. Kaseva earlier. But the question was, why was test and treat dropped from the consolidated 2020 WHO TPT guidelines for adult household contacts? Dr. Kaseva?
Yes, greetings once again. I hope you can see and hear me.
Yes,
so thank you very much for the question. Indeed, it's very important. And first, I would say that absolutely no, test and treat principle was not dropped, but we are, according to our guidelines, in case if testing is not available, it should not be the reason of non-provision of TPT. So actually everything is there, and I would request to look in more details in our guidelines, and if further clarification will be needed, we are always here but it's not the case. We are advocating strongly, and we're giving more opportunities for TPT.
Thank you for that clarification, because I think TPT is such a critical part of our pillars for ending TB now. So I really wanted to clarify that at the beginning. So the next, I think, is an interesting question that we could take through all of our speakers. And that is from Peter Owedi. It is that at 1.5 million deaths a year, we're not seeing the same response to TB that we are to COVID, even after the visibility of the UN HLM. What can the TB community do as a whole to initiate and galvanize that same type of COVID response around our TB issues? And I think what we'll do is, if it's all right, we'll do Dr. Kaseva, then we'll do Tushar, then we'll do Blessy on this.
So thank you. I would say this is one of the fundamental questions for all of us. TB remains the biggest infectious killer in the world. And now we are looking and comparing. Of course, we're not competing between diseases because all lives matter. but definitely we should learn the lessons from this situation. And of course, for me personally, number one lesson, we should change our approaches and principles of advocacy. It should be more ambitious, more strong, and we should not be shy, because we're always like feeling a little bit not comfortable to request, to demand additional funding, additional resources, because it's old disease and everybody knows about TB, and we're repeating. We should be very ambitious. Indeed, all lives matter, and we can see that even in the low-income countries where domestic resources are traditionally issue, they are coming for the COVID response, and it means if there is a high level of commitments and understanding and sometimes fear, the resources are not the issue at all. So that's why I think that we should be more ambitious and strong with our requests, but in the same time we can capitalize, sorry for saying this, and build on the current situation, because there are a lot of similarities between two diseases, and they're both affecting primarily lungs. They have some similarity in symptoms, and furthermore, TB community has capacity networks, lab networks to test, to treat both, which in principle is already happening. So that's why we should revise our traditional approaches and try to be more ambitious. I will stop with this.
Thank you. Tushar.
Thank you, Jane. And it's a pleasure to be here. So I think the simple answer to this question, why is TB not as big an issue as COVID is, despite there being many more deaths from it? I think the simple answer to that question is because TB has been resigned to the developing world. It has not been an issue in Western countries for a very long time, which has meant that there's been a perception of TB being seen as, okay, this is a national issue for some countries to be addressing, rather than this being a collective issue for all of us to be addressing. And I hope that with COVID this year, we will realize that health issues such as TB are not just issues that countries need to address. These are things that affect us across borders. We say this all the time, TB does not respect borders, neither does COVID. And we need to be making sure that we're thinking about this from a more global context. It's a shared burden. It's our collective responsibility to do this. And I just want to echo Dr. Madhukar Pai's presentation yesterday and say that we really need to start thinking about what TB can be learning from COVID. I know in the initial days, just like Dr. Pai said, in March and so around March, we were all saying, okay, TB has so much to offer to COVID. We've been doing contact tracing. It's an airborne disease. But I mean, over the course of this year, we've really seen this incredible, enormous acceleration for COVID, literally trillions of dollars being committed to COVID. And we're still struggling with a $2 billion gap. I mean, it kind of sounds like a joke, but it's something that we really need to be taken seriously. So I'm hoping fundamentally we will start seeing communicable diseases like this more as a shared collective issue and not something that is resigned to certain countries.
Thank you, Peter, for that question. So I'm going to answer to the point. You basically said, what can TB community do to initiate the same COVID response for TB in the light of all these deaths? The fundamental thing that we need to do is we cannot and we should not shift focus. The donors cannot reallocate TB funding for COVID. TB lives are important. COVID lives are important, but not at the cost of one. And when we say one, we know which one falls off the radar. That is TB. So they cannot do that. Technical agencies, people who are leading the response, WHO is doing a fantastic job in COVID response. And we urge them to maintain the same focus on TB, to work with the countries to ask for TB progress at country level from the national TB programs. And I heard a couple of days ago something very disturbing. A national TB program manager said it was a conscious decision to shift focus and resources from TB to COVID. That made me very sad. Did the people who are dying of TB every day agree to this decision? I don't think so. Did the families and the communities who suffer on a daily basis agree to this decision? I don't think so. So people who have the power to make these decisions need to keep the person who's suffering from TB at the center of their focus when they make decisions. And I plead with the people who have the power in your hands, do not shift your focus from TB. Yes, we can learn from COVID. We have a lot to learn, but unless and until we consciously decide to move to accelerate our efforts to ending TB, TB will continue to be in the back burner and will fall off the radar. The deaths will only increase, the suffering will increase, and it will be our responsibility. Thank you.
Thank you, Blessy. We have a follow-up question from James Bryden going to Tushar, and that is that from your perspective, which countries have impressed you the most in their efforts to end TB and which have been the most disappointing?
That's a difficult question to answer, but I mean, I'll start with the country that's definitely impressed me the most, and thank you for that. I say this as often as I possibly can because I'm a fan, but it's been Indonesia, hands down. This year, the kind of momentum we've seen from Indonesia in terms of coordinating between all the key stakeholders has been absolutely fantastic. At the beginning of the pandemic, the government put into place a TB regulation for implementation of the TB protocol during the lockdown. So that in itself was quite responsive, making sure that TB services were being protected during the lockdown. And subsequent to that, over the course of a couple of months, as the protocol was being implemented, what happened simultaneously was that civil society organizations, including, headed by the Stop TB Partnership Indonesia, worked with several community organizations as well as with parliamentarians to do an assessment of the implementation of this TB protocol. And they did a survey, which I think had about 4,500 respondents from across the country, which is absolutely amazing. And the findings of these of this survey was then channeled back through the National TB program to the actual national response. And all of this was being backed up and being talked to, the government was being talked to by members of parliament the entire time, making sure that the pressure was continuously on, saying, despite COVID, we can't let TB just fall by the wayside. And the receptiveness of each of these different stakeholders to really take on these recommendations from one another was absolutely fantastic. So, for me, Indonesia was a shining example of what accountability really can look like. I hesitate to say which countries have been the most disappointing. I think it's not a fair question, fundamentally, because I personally also believe that accountability will not look the same in each country. What works in Indonesia will not work in Vietnam. What works in Vietnam will not work in Nigeria or Cameroon. So it's really up to us to decide what we want accountability to look like at the national level, making sure that we're backing this up, again, with data. We're backing this up with actual progress on the ground, and we're making sure that this information is being actively exchanged between people. So I think the core concept here is, one, data, and two, making sure that this data is being shared between the different partners, and there's a constant communication between all the key stakeholders. So, I'm not going to say who's not been doing very well. I think we've all not been doing very well, and Indonesia is just a really, really good example of who has. Thank you.
So the message is we all just need to keep pushing. I'd like to change a little bit our topic. James Bryden has also given another interesting question that I think could go to the entire group. There's a very big push now to strengthen health systems. How can TB efforts benefit from this? What systems improvement would most benefit the TB effort? And for instance, how can we use this to address the health workforce issues? Again, I think we'll go through all three people, but let me throw this to Dr. Kaseva first. Thank you.
Yes, thank you very much. But I would like to use this opportunity and to comment a little bit on previous question. And I would recommend you and refer you to our latest global TB report. There you can find a lot of details on the high TB burden countries in terms how they are advancing with the accountability framework, adaptation and implementation, as well as what did happen with the essential services and how did they drop notification. Unfortunately, the picture is very sad, and also we should keep in mind even for the advocacy. But according to the modeling, we can predict additional further growth in TB incidence and death. And this is a very, very concerning issue, but it should be also used for the advocacy. We don't want to face the situation when at the end of the, hopefully it will happen soon, of the COVID pandemic, we will go into the TB pandemic with the huge outbreaks in many countries. And these predictions are really, unfortunately, realistic. Now, in terms of strengthening health systems, this is like a philosophic discussion. Programs are contributing into the systems, or systems are strengthening programs. In terms of TB programs, as we are among the oldest programs because of disease and because of our long-lasting efforts, I think that at least in the highest TB burden countries, we are fundamental. We are among the main programs which create the health systems themselves. That's why we can see even now how heavily TB programs were engaged into the COVID response. It clearly shows that all the investments in TB programs were in principle investments in the TB, in the strengthening of the health systems. That's why programs are able to respond to the COVID and also to provide in the situation when there is support from the government, continuation of TB services. So that's why we should use this as an example for a highlighting role of TB programs, at least in the highest TB burden countries. But for sure, when we're talking about multi-sectoral collaboration, multidisciplinary, it's becoming obvious with the key drivers, with the social determinants of TB epidemic, that without clear connections between HIV and TB programs, between non-communicable diseases such as diabetes, mental health, which is also growing again because of COVID, we will hardly effectively combat TB. Primary health care and TB services, it's another undiscussable area where we should strengthen our linkages and collaboration. So we can definitely benefit from these linkages, but in the same time, we are contributing heavily. That's why this should be another reason for attracting additional resources for TB programs. Okay, thank you.
Thank you. Tushar, do you have any comments about health system strengthening?
Yes, absolutely. Thank you so much for that. So, I mean, to answer the question again, like, I think the simple answer to this is that TB has everything to gain from investment in universal health coverage or investment in health system strengthening. And here, I really want to agree with what Teresa said, is that all of this, what we found over the course of this pandemic is that all of our investment in TB infrastructure and TB staff has directly benefited the health system. And I think maybe the way for us to be looking at this is also to think of TB as a really good indicator of the overall well-being of a health system. So the more strain a health system is under, the more TB there is bound to be, because TB is not just a disease that you get from breathing in. It's impacted by where you live. It's impacted by your nutritional status. It's impacted by your access to education. It's impacted by housing, and it has all of these various components. So I think ultimately it's a feedback cycle. The greater we're investing in health systems, the less TB we're going to see. And as we see less TB, that hopefully does mean that we're having more robust health systems. And yeah, I mean, that I think is my answer. Thank you.
Thank you. Blessy, would you like to comment on the view of the community?
Yes, very quickly. So from the survey, the civil society survey, community perspectives of the COVID pandemic and how it has affected TB, many of the respondents said that the health systems are already weak. we must realize that even before COVID, we were lagging behind in TB progress. And COVID really hit us hard. So we should take up the opportunity COVID is providing in strengthening the health systems, because there's so much happening, and make it work for TB. How can we leverage the investments of COVID that are going into strengthening the systems at country level, and then see how we can leverage that and make it work for TB. I think so. There is a positive factor there as well. One, to keep the focus on TB. Second, to take the good that is happening in COVID and make it work for TB. Thank you.
Thank you, Blessy. We have about 5 minutes left, and it's a hard stop, but I wanted to bring in this interesting question from Mohammed Hussein. Amidst the current COVID-19 pandemic, can we confidently say in retrospect that we've been doing enough to protect our TB service care providers? These are our really frontline workers. I'm not sure who would like to address that. Any volunteers? Dr. Teresa.
Yes, thank you. Difficult but very important question. Of course, in front of this pandemic and situation with the TB services, no one of us can say that we've done at best and all what we can. Of course, we should do more, and we will do more altogether. And this was a real test for the health system, for the TB programs as well. Of course, first of all, we should do more to protect our community health workers, but because they're becoming they're at first front, and they're our hope and hope of millions of patients to provide continuation of services. But in the same time, I can share one example which I gave recently, a few days ago, during our NTB strategy summit, when we had discussion with the NTP managers. I asked them, please, can you give me clear response? We have good updated recently guidelines, for example, for fully oral treatment of our MDR TB patients, several options for the TB preventive treatment. We have digital tools for provision home-based treatment. So, but why it still takes us so long to adapt and implement these guidelines in the country? When we are comparing with the COVID, guidelines are changing on almost on weekly basis, and countries, programs are taking, I don't mean TB programs, immediately and using it for the patient. Why so different? Why we cannot do and more proactively for our TB programs? This is the question to all of us. And of course, we are starting from ourselves, WHO, and we will continue doing our best. But I think that this question should be addressed to everyone who is involved in the TB response and providing support. Let's start from ourselves, and definitely there will be positive changes. Thank you.
Thank you. Blessy or Tushar? I saw Tushar's hand go up. Go ahead, Tushar. We have 2 minutes.
Okay, I'll be very brief. I mean, I just wanted to say I completely agree with Teresa here again. But again, the short answer to the question is, have we done enough? We have not. But I also want to use this opportunity to just highlight that this is exactly the place where members of parliament can play a very, very crucial role, because they have the capacity to access all of the different key stakeholders. They can be speaking with civil society, they can be speaking with technical experts such as the WHO, and they have the capacity to pass legislation or vote on budgets in parliament. Therefore, making sure that our elected representatives are fully engaged on this issue is going to be absolutely vital. We talk about the lack of political will. That means we have to build that political will, you know. So I mean, just noting that parliamentarians will play a very, very crucial role in making sure that we're prepared for the next pandemic when it comes. Thank you.
Blessy, 1 minute.
Yeah, very quickly. The answer to that is no. We haven't done enough. to protect our TB frontline workers. Again, there is a certain discrimination there. People who are working in COVID do manage to get protective equipment, but people working in TB do not. But here's where I really want to appreciate and laud our civil society organizations that have actually come forward and put together resources to provide for the TB frontline workers. So I think this is an area we can greatly improve on. Thank you.
Thank you all. We're coming to the end of our session. I want to thank all our speakers with one clear message. There's a lot to do. We need to keep our eyes on the prize, and we need to work with urgency every day to end the suffering and death of our TB patients. Please be safe there, enjoy the conference, and thank you all for all of the great questions.